Hi, welcome to my channel. Thank you for joining me today. So my name is Joyce and I'm a physician associate in general practice, and I do videos on all things health. I talk about health and wellness, mental health, physical health, and recently I started doing workout videos as well. So if this is something that interests you, I think it should interest all of us, then please stick with me on this channel and come along with me on this journey. So today we are going to talk about celiac disease. So if you have celiac disease or you know someone who has celiac disease, then please stay tuned, and it will be great to know what your experience has been with the condition. So I won't talk any further, I'll just jump straight into the video. All right. So basically what it is a chronic condition. It is an autoimmune condition where someone has an intolerance to gluten, and as a result of that there is damage to the small intestines, which causes nutrient malabsorption. So simplified, if you have celiac, you are gluten intolerant. When you eat foods that have gluten in them, it causes you to have damage to the small intestine, and as a result of that damage, your nutritional value from the food that you're eating is compromised because you are not absorbing the nutrients as you normally should if you didn't have any intolerance to gluten. Now, that was a mouthful. I do hope you understand what that is now. So we are going to go straight into the risk factors, or what causes someone to have an intolerance to gluten. One is, it is an autoimmune condition. So it's not that there is something that you have done to have it. Some people are just born with it. Also, being type 1 diabetic is a risk factor for celiac, as well as having Down syndrome as well. A family history of celiac increases your risk of also having celiac disease. In terms of symptoms, I'm going to put them into two different classes. There are the gastric symptoms and then the non-gastric symptoms. So the gastric symptoms are diarrhea, abdominal pain, bloating, constipation, and also being gassy. The non-gastric symptoms are fatigue, weight loss, anemia, so iron deficiency in other words as well, and joint pains you might notice, depression and anxiety as well. So going on to the mental health side of things as well. If you can imagine, if you are someone who is intolerant to gluten and you are not getting as much benefit from the nutrients that you're getting from your food, and you're always having tummy pain and having to watch everything that you're eating, that would get anyone down. So hence why you can have depression and anxiety as well. Investigations and diagnosis. So when you present to myself or any other clinician, I would ask you your symptoms, and then going on from that, we would do some blood tests. In the blood tests, we are checking for full blood count. We're also checking your folate and your B12, and we are also checking for celiac screening. So there is a specific blood test that can be done, which would be positive if you are intolerant to gluten. And if it is confirmed, then you would definitely need a referral to gastroenterology. You might also need like genetics testing, and you might also need a camera down your throat. It's not routinely offered, but you could need those depending on your situation. In terms of management, the key thing is gluten-free foods. That's one. And also you might have to supplement. So like I said, if we check your B12 and folate, and if it's low, then we would recommend that you supplement on that. And the other thing is, we would need to regularly follow up someone with celiac disease and there would definitely be an involvement with a dietitian to advise on lifestyle, on food, what types of food someone should eat. The good thing about it now is there are so many options for gluten-free foods. So if someone has celiac, there are options out there for what they can have as an alternative. Okay, so I do hope this has been helpful. If it has been helpful, then you know what to do. You need to click the like, share, and obviously subscribe to this channel, because we have fun on this channel. We are talking all things health and educating each other. And by all means, if you do have a specific condition that you want me to talk about, then let me know. At the moment, I'm doing the gastro series, which is all things about your tummy. But if you have other things that you are interested in, then let me know. Otherwise, I will leave you until the next time. I do post videos every week. I do try to, and I have been consistent so far. So yeah, I'll catch you on another one. Take care. Bye.